everybody. Hope you all are fine and enjoying good state of health. The topic under discussion today is fascia lata, which has been divided into two parts. So at the end of part 1, the participant should be able to define fascia and describe superficial and deep fascia, define fascia lata, describe structure of fascia lata, and describe the attachment and extent of fascia lata. In part 2, we will discuss the modifications of fascia lata, that is iliotibial tract, cribriform fascia, and intermuscular septa and fascial compartments, along with clinical applications of the fascia lata. Fascia is a sheet or band of fibrous tissue which is located deep to skin, and it lines, invests, and separates all the structures within the body. Fascia is of three types: superficial, deep, and visceral. First, the superficial, which is also named as subcutaneous tissue, is an irregular layer of loose connective tissue located immediately deep to skin and usually consists of: number one, a fatty layer, which is also named as panniculus adiposus. This layer may include a muscular layer. Then it is named as stratum musculosum, and the example is platysma, which is present in upper part of the chest and in the neck. Second layer of superficial fascia is a fibrous layer, which is present as a membranous layer and is also named as stratum membranosum. Superficial as a whole allows free movement of the skin over the underlying structures. Second is the deep fascia, which is a thin fibrous membrane divide of fat, is located deep to superficial fascia and among the deeper structures. There it invests muscles. When it invests muscle, it is divided into superficial and deeper layers. It also separates several groups of muscles and individual muscles. It also forms sheaths for the neurovascular bundles. It is specialized around the joints in the shape of ligaments. It also envelops organs and glands, where it is named as capsules. The deep fascia binds all structures of the body as a firm, compact mass. Third is visceral fascia, which number one wraps organs in the shape of serous membrane, which consists of parietal and visceral layer. Examples are pleura, peritoneum, pericardium, and meninges. Visceral fascia also suspends organ in the shape of mesenteries, mesogastria, and mesocolon, etc. Fascia lata is a tough, fibrous, deep fascial sheath which envelops thigh like a sleeve or a strong and elasticated stocking with too large the top. It extends from root of the limb above and continues with the deep fascia of the leg below. It prolongs inward as intermuscular septa and thickens laterally as iliotibial tract, which serves as a site of muscle attachments. As regard its structure, it is of variable thickness. It is thicker in the upper and lateral part of the thigh, where it splits to receive gluteus maximus and tensor fascia latae muscles. Very thin at upper and medial part, where it covers the adductors of the thigh. Thick and strong laterally, where it forms the iliotibial tract. Thick and strong around the knee, where it receives fibrous expansions from number one, tendon of biceps femoris laterally, number two, sartorius medially, number three, quadriceps femoris in front, and it becomes very thick posteriorly and forms the strong popliteal fascia. The attachments and extent of fascia lata. At its upper extent, it is attached to the root of the lower limb as a whole. If we start its attachment from the pubic tubercle on the anterior aspect, it is attached to the pubic tubercle, inguinal ligament, and anterior superior iliac spine. Then it is attached onto the outer lip of the iliac crest on the lateral aspect of the thigh. Then it goes on to sacrum, coccyx, sacrotuberous ligament, and ischial tuberosity on the posterior aspect of the thigh. Then it moves on to ischiopubic ramus, body of the pubis, and below the pubic tubercle at the starting point, it passes on to the pecten pubis on the medial aspect of the lower limb. The middle part encircles muscle of the thigh like a sleeve, and here it also gives intermuscular septa, and it also thickens as iliotibial tract. The lower part of the fascia lata on the front and side of the knee is attached to all the bony prominences such as condyles of the femur and condyles of the tibia, head of fibula, and patella. On the posterior aspect, it becomes thickened and forms the popliteal fascia. Down below as a whole, it becomes continuous with deep fascia of the leg. On the lateral aspect of the thigh in its upper part, fascia lata splits into two layers and receives on the posterior part the 3/4 of the tendon of the gluteus maximus, and on its anterior part the tensor fascia lati muscle. The stratum of this split passes beneath the tensor fascia lati and joins capsule of the hip joint. Below, the fascia lata extends down on the lateral aspect of the thigh as a strong band, the iliotibial tract, which is attached to the anterolateral aspect of the upper end of the tibia. The tensor fascia lati muscle gets origin from the anterior superior iliac spine and the adjacent part of the iliac crest. The fibers of this muscle travel downward, laterally, and backward and get inserted into the anterior part of the upper end of iliotibial tract. And through this tract, this muscle gets attachment to the lateral part of the upper end of tibia. Tensor fascia lati is innervated by superior gluteal nerve. As regard the action, this muscle is abductor, flexor, and medial rotator of the lower limb. It also helps stabilize hip and knee joints by putting tension on the iliotibial tract. When opposite foot is lifted, tensor fascia lati pulls and tightens the iliotibial tract. It also tenses fascia lata, thus producing a true stocking effect. This effect keeps all the muscles groups of the thigh close to the femur. As regard the clinical relevance, as the fascia lata is attached to the inguinal ligament, extension of the thigh pulls the anterior abdominal wall downwards and it becomes tense. To relax the abdominal wall fully for palpation during examination of the abdomen, patient is asked to draw legs up. This, this action overcomes the pull of the fascia lata on anterior abdominal wall and the examination becomes easy. To be continued as part 2 of the present topic.